So I'm a cardiac surgeon. Cardiac surgeons deal with the heart and the great vessels, which basically means the ascending aorta and the aortic arch as it goes around the top of the chest. So the most common thing we deal with, about 2/3 of our work, about 60 to 70% of our work, is coronary artery disease. So in which we treat with coronary artery bypass grafting.
Mm-hmm.
And the other sort of 20% is valvular disease, so aortic valves and mitral valves. And then to a lesser extent is transplant, mechanical hearts. And then there's a whole other specialty within our specialty of congenital heart surgery. So there's I think 10 surgeons here now. 3 of them, all they do is operate on kids. And they do about 600 cases a year, right from newborns that are weighing 800 grams up to teenagers to people that lived into adulthood with diseases they were born with in their hearts. Always loved working with my hands, and I've always been fascinated with physiology and anatomy, so it was the perfect combination. It's good, it's interesting, it's challenging, it's rewarding, because a big part of what we do in cardiac surgery is address lesions in the heart that are causing patients symptoms, and in doing so you make most patients, not all, most patients feel better. A typical day, I guess it's better to describe a typical week. I operate 2 to 3 days a week. I spend usually 1 day in the office doing clinical stuff and paperwork and getting caught up on research and emails. And then usually approximately 1 day every week or every other week is spent in clinics, seeing preoperative patients or following up with postoperative patients. So each day can be a little variable, but for the most part, most days start at around 7 or 8. We don't crack chests, we don't smash chests. We carefully divide the sternum down the midline, and we wire it together real solid at the end of the case. So we use a saw. It's extremely, extremely, extremely rare for patients to die in the operating room. Most patients that I was thinking about the other day, that anybody that's really ever died in the operating room was probably almost dead when they came to the operating room. So it's extremely, extremely, extremely rare to die in the operating room or not be able to get them off the table. So that's another myth. So the patient comes into the OR, the anesthesiologist puts him to sleep, puts in the breathing tube, puts in all the intravenous and access lines, puts on the monitors. We prep and drape their chest, their belly, usually their legs. There's some modified procedures now where we'll just divide the upper half of the sternum for aortic valve replacements. One of my partners is getting very good at going after the mitral valve through through the right chest. We open the chest, open up the sac around the heart. And then almost always with heart surgery we have to put them on the heart-lung machine, and then we stop the heart from beating so it's completely still, and then we open the heart up and do whatever we have to do. Close the heart up and then let the heart start beating again, and then wean them off the heart-lung machine. Back to normal usually means, again, the 2 things we're trying to achieve in cardiac surgery is make people live longer. So we got coronary disease or valvular disease that will limit their lifespan, so we try to make them live longer, but also we're trying to make them feel better. Most of these disease processes do impact patients' ability to do activities they don't like to do, and impacts their quality of life. So most patients should expect to feel better once they recover from their heart surgery. Most patients should expect to feel better than they did before. The real key to recovery from surgery is getting up, getting walking, getting moving. The old days of laying in bed for 2 weeks and having everybody feed you and everything like that is very detrimental. Smoking destroys the body. If there is one thing we could get across to high school students, I mean, smoking causes high blood pressure, which causes strokes. Smoking causes coronary disease, which causes heart attacks. Smoking causes lung cancer and mouth cancer, and esophageal cancer and stomach cancer and bladder cancer and colon cancer. Destroys every part of the body. And for females, it also destroys your skin, and it causes them to age incredibly rapidly.